Good morning. I'm Amresh Tiwary, editor publisher of Double Helical. This is being published from Delhi NCR region. This is monthly health magazine. And Dr. A.K. Agarwal, I can say he's a big fan of medical fraternity. He's our chief advisor. And I'm kind privileged to announce that today webinar is a holistic medicine. As you know that this is a healthcare approach that considers the whole person, body, mind, spirit, and emotions. The quest for optimal health and wellness, often incorporating both conventional and complementary therapies. For the discussion of the webinar, we have the eminent personalities like Dr. R.K. Tuli. He is considered as a father of holistic medicine, Indian father of holistic medicine, and established Soham Institute in the New Delhi, Trans College, New Delhi. And we have Dr. Gulati. He is a Vice-Chancellor, eminent ENT specialist, Vice-Chancellor of Mahatma Gandhi University, Jaipur. And we have the very eminent personality, Padma Shri, and HOD of the Community Medicine, All India Institute of Medical Science, Dr. C.K. Pandav, Chandrakant Sambhaji Pandava. And no need to introduce one of my mentor, Dr. A.K. Agarwal Sahab, Arun Agarwal Sahab. He is an expert and very soft spoken and very eminent personality in the healthcare personality. He's right now, he's a medical advisor, clinical research and innovation, Apollo Group Hospital, and ex-dean of the Maulana Azad Medical College. I request to Dr. Agarwal, please moderate the today webinar. Thank you.
Thank you, Tiwary ji. Good morning to all my friends, colleagues in front of me. Today morning is very special. Let me say convey my thanks to Double Helical and Mr. Tiwary for organizing this webinar regularly as much as possible. And today's topic is very, very different. And this is nothing but the holistic medicine, which is the need of our, which is perhaps everybody in India is looking towards holistic medicine. But in what way? What is holistic medicine? What is the approach to holistic medicine? What is the legal approach to the holistic medicine? What is the public requirement of holistic medicine? These are the important topics which we are going to discuss through our expert. Tiwary has already introduced the three experts of today. Needless to say that Dr. R.K. Tuli is practically originator of the holistic medicine in this era. And of course, he started quite long back with the Apollo Group of Hospital. And now he is having his own wonderful setup. Welcome, Tuli sahab. Our next expert is Dr. Achal Gulati. Dr. Gulati is my friend, our friend, colleague, and he is the person who started his career as professor of ENT and then as administrator and principal of director of many medical colleges. And thereafter, he headed the biggest organization for Indian medical profession, that is NMC, as president. And now he is Vice-Chancellor of a very important university for our country, that is Mahatma Gandhi University of Medical Sciences, Jaipur. And my third expert is a person who is, I appreciate him from bottom of my heart, the person who is leading the public health activity for the country. And he is the person from All India Institute of Medicine, of Medical Sciences. Pandav sahab, you know, I started my career also from your department in AIIMS. So with this, I will like to start the discussion. And first of all, I like to invite our friend Dr. Tuli. Dr. Tuli, we are going to discuss today holistic medicine. Have you are a person who did your education in modern medicine or allopathic system, and then started your career, and ultimately you turned into holistic medicine. What was the reason, and what is the strength of holistic medicine? We'd like to hear from.
I'm grateful to Professor Agarwal for such an elaborate introduction, and my gratitude to Double Helical for having created this opportunity where Dr. Agarwal has already said that there is a great need in the country and all over the world. And the World Health Organization has been recommending that since no one system of medicine is perfect, and its program Health for All 2000 AD and subsequent efforts have failed to bring in health for all. So they have said that this is essential that we complement the best practices of modern medicine with the various traditional systems of health. And there's WHO document which also promotes this. So now holistic medicine is an approach to the human being as a whole, not merely the physical or the organ-related super specialty approach as being practiced in modern medicine today, but taking the human being as not only the body, the mind, and the soul. That is the invisible factor between life and no life. Even Hippocrates, father of the modern medicine, had made this observation that the greatest factor in our getting well is the invisible life force within each one of us. And also, Hippocrates had stated primum non nocere, that is, first do no harm. Unfortunately, in the practice of modern medicine today, there is no single medicine or intervention which can promise us this. And also the World Health Organization is very aware. If I read a document by the World Health Organization which states that unsafe medication and medical errors are a leading cause of injury and avoidable harm. The cost of which is in medication errors has been estimated at 42 billion US dollars annually, which is about 4 times the national health budget of our country. So with all these things combined, so treating the human being as a whole helps us to overcome this inherent limitation of modern medicine. It is well supported by the Charaka Samhita, by our Ayurveda, which treats the human being as a whole and says it is the duty of the physician to take care of the health of the people. Now, you asked how my transformation started. Well, one, I will give the credit to my teachers in my alma mater, the Armed Forces Medical College, where in 1964, the address to the incoming students by the then dean was that young men and ladies, you have come to this college to become doctors, but the aim of this institution is not to only make you doctors, but to play the role of a friend, philosopher, and guide. And over our clinical years, our teachers emphasize the practice of conservative medicine, which becomes very valid today when most of the diseases are being attributed to lifestyle disorders. I would say not only the non-communicable diseases, even the communicable diseases can be highly attributed to the lifestyle disturbances which compromise with our immunity. So that set of mind I continued to practice in my formative years, and I found then, I mean, in the early 70s, that the people who had just been detected with the diabetes or a hypertension, and I was an aviation medicine specialist looking after the fighter pilots, which requires the highest level of fitness. And and they go through a very detailed annual medical examination, and if anybody is found to have slight variation, he's immediately grounded, and that means he loses his career. And my duty is to keep the pilot flying. If the pilot fails to do his medical test, that is I take it as the failure of my duty. So when we found that any freshly detected diabetes or hypertension or even asymptomatic coronary artery disease, these could all be reversed by correcting those days what was called the risk factors, and which have taken the shape of lifestyle diseases now 50 years later, and medical science finds no. So at the primary level, this must be enforced, that we follow and do the lifestyle changes. Even the latest textbook of Davidson says that unless an emergency, everybody should be, for a period of 3 to 6 months, try to correct their lifestyle. That is the practice of conservative medicine, and help the person to naturally regain, and that will give the person a lifelong of health, instead of reducing them to making them dependent on the medications, and no medication, unfortunately, is a perfect remedy, and it takes its toll sooner or later in the shape of target organ damage and multiple diseases, needing to visit various specialists and creating more and more morbidity, progressive morbidity, even respiratory diseases, which is a very common cause. Today, the official figures state that since 1990, the incidence of respiratory diseases has increased by 40%. And all the drugs that they do is palliative relief. There is no cure for any of these things. But by complementing the best practices of modern medicine with these drug-free modalities, I have a vast reservoir of experience, including the who's who of the country, to endorse that this helps them to reverse their disease. And today I'm in a state to mention that this all-inclusive approach to health, complementing modern medicine with the drug-free modalities. I said drug-free modalities because there's a question coming up that we cannot prescribe medicines from different systems of medicine, of different systems of health to the same patient concurrently, because they are, number one, their philosophy is entirely different. Two, there could be unknown drug interactions, the hazards, which we do not know about. But you believe me, my experience, that there is no need to use any drugs at all. When we are talking of that, we use the complementary methods. For example, the Ayurveda. Ayurveda is a lifestyle. Ayurveda is like the food we eat. As Hippocrates said, use thy food as thy medicine. And even Ayurveda says, you are what you eat. So, with these lifestyle and living a yogic way of life, yoga is Ashtang, living a yogic way of life, and this very yoga, the science of yoga, has been developed by the Chinese into what is called a system of acupuncture, which is nothing but restoring the homeostasis of the individual. Now, with these galaxy of experts, medical experts on the panel, sir, I would submit to you that there is no medical intervention which helps to restore the cause of the disease. I am designed to be in good health. That is, my homeostasis or my milieu interior is in harmony. By following the wrong lifestyle, further inflicted by the various medications, I further damage my homeostasis, and the disease only keeps on increasing and growing, raising the morbidity and taking me to a level of. So these practices help us to restore the homeostasis of the individual. And human being is not like a machine which cannot repair itself. It does not require a continuous replacement of parts or transplant of the organs, etc. You give them in a reasonable time, all this can be reversible. Like I say, earlier the better. Once a person has developed a problem, the earlier it is tackled and we restore the homeostasis of the individual, as is the
Dr. Tuli,
nature, that the healing process
Tuli,
takes
sir?
over. Yes, sir. So
we are just in the first round, we are talking about
yes,
the
sir. So the
fundamentals
having
of the
restored,
concept. Yes.
now these
Then we'll
alternate
come to
systems. Yes, one
yes.
minute. These alternate systems helps us to restore the homeostasis, thereby my own natural healing mechanism, and which at any stage of sickness helps us to restore. Having eliminated the cause of sickness, it helps to restore the health and a higher state of health, what is called wellness. Yes, sir.
Thank you, Dr. Tuli, for your for speaking out of your experience and what you felt, and I appreciate that right from the beginning when you joined Armed Forces Medical College, the whole concept you picked up, and then it ultimately turned into a holistic approach. Dr. Gulati. Dr. Gulati, can you hear me? Dr. Achal Gulati?
Ji, sir. Am I
Yes.
audible, sir?
Yes,
Ji.
thank you. You have just now heard Dr. Tuli.
Ji, sir.
And the holistic approach, you heard his version. I'm confused. Why I'm confused? That our country has given us the privileges from the point of view that they have created National Medical Council, they have created AIIMS, right? And this is the privilege of all those practitioners who are registered under these two domains to look after the health of the people of India. So I will like you to comment upon your views about holistic medicine, number one. What is the status now and what is going to be the future? Keeping only one thing in mind, that the benefit of the patient is our aim.
Well, Namaskar, Dr. Agarwal, sir. I think having heard Dr. Tuli, I'm perfectly in agreement with him what he has said. So let me just go back to the basic definition of health as far as the WHO is concerned, which said physical, mental, social, emotional well-being. Now, let me add to it a little few more things. I add physical, mental, social, emotional, spiritual, ethical, and familial healthcare, which is very important. I agree that a human being is a self-healing body, and that is what formed the principle of having a natural cycle, natural history of a disease. So every disease follows a particular cycle in which it heals itself, goes into a complication. It may result in a mortality. It may result into different morbidities, and that is a natural history of disease. I mean, we've had pandemics, we've had epidemics, which do control themselves. I think the recent one which we had for COVID, we saw so many things and we learned so many things from that COVID pandemic, which probably changed the outlook of the medicine. So now let me come to human body as a car. एक गाड़ी के तरीके से अगर उसको मैं देखता हूँ, what controls a car? How does a car work? Mechanical engineer an automobile engineer, a computer engineer, or maybe an electrical engineer. So it is not one engineer who controls the car. So that is why the concept about leaving aside mechanical, electronics, computer, automobile, the term mechatronics came into the picture, which means that all these sciences of engineering combined together to bring about one entity which is there, which is as a motor car. So the same way it's a human being. It is not just flesh and bones. It consists of a lot many things. It consists of the body. It consists of the mind, the support, the emotion, the spirit. So when you're looking at a human body, all these things have to be addressed. And there is when we address all these things, we need to look at the well-being of the person without causing him harm. So there would be standard operating procedures for any sickness that comes into the picture, which would be based upon evidence-based medicine. So when we talk about evidence-based medicine, I look at evidence-based medicine, which is scientifically proved, which has a cause and which has an effect without causing any harm to the patient. That is the first thing that has to be done. So when we look at this issue, so when we look at this issue, we see the body as a whole. And when we see our treatment, we need to look at the preventive aspect, the promotive aspect, the curative aspect, the therapeutic aspect, and the symptomatic aspect. And only when all the aspects are combined into one, we come to what should exactly be a proper therapeutic management or proper medical management, where all the issues are addressed. So if I look at clinical medicine as it exists today, or holistic medicine as Dr. Tuli has propagated, I look at it that it has to be a mix and match of everything. God created man. It is not perfect. God created woman. She is not perfect. Then God created a union of the two and married the two, which became almost perfect. So whenever we have a mixture of two, a combination of two persons, personalities, systems, whatever you may term it as, it always turns into a better product, much more supportive product. So this is my take currently on as holistic medicine exists and as clinical medicine exists. Both have their importance in our situation, but both need to work hand in hand. They need to augment each other, never to replace each other. So that's what my take on it is at present, sir.
Thank you, Dr. Gulati, for explaining me your point of views, and I agree. Perhaps every therapy has its own place, and we have to find out the strength of each and every therapy in the best benefit of the patient. Right? We have total agreement to that. But now I would like to request my friend, Dr. Pandav. How are you, sir? Dr. Pandav, can you hear me?
Sir, Dr. Pandav has a problem in the laptop, so carry on. He will join later on, please.
Okay. अब of course, Dr. Pandav से जो हमारा most important question था, he being the person of public health, I'm sure he'll be joining back. And that what is the expectation of the society and the public from us? And the public and society, Dr. Tuli said that do no harm, right? So everybody expect that I want to be treated with whatever regime you want to treat me, but at the same time, I expect improvement and improvement, if not the same level, because depending upon what sort of problem I'm suffering with, but at the same time, due to the treatment, there should not be any deterioration. Dr. Tuli Saab, coming back to you, you gave a wonderful description. Can you tell us few of the examples? Okay. Okay, first you give me your example, then I will put one example from myself.
No, example, I would, what transformed me, you see, I was doing my PG post-graduation MD medicine at the Army Hospital in the year 1976-77. And that time, our professor of anesthesia, who had just returned from China, having undergone training in acupuncture and analgesia, and all the head of departments from Delhi's medical colleges, the Chinese had invited them to show how the analgesia, in major surgery, works without giving any anesthetic drugs. And but the surgeons would not permit these anesthetists to do this gimmick in the operation theaters, and the government of India set up pain clinics in all the Delhi's hospitals. And part of that, our professor there, Colonel Chandani, he was awarded 2 research projects on bronchial asthma and chronic backache. And I saw most of these patients who were referred there, they were started getting well. And you know, after nearly 50 years, there is no cure for bronchial asthma. And one of the biggest causes of pain and disability in the human being remains is the backache. So, and I started taking interest because I thought if I can learn acupuncture, it will make me a better physician. And professor told me, look, you are a budding physician. I am at the fag end of my career, and I have never been a clinician. As an anesthetist, I have not directly handled the patients. So this thing will prosper in you. And I went to China to get the training in acupuncture. And one day in a class, if class was being held in an open space, and I was leaning against a tree. And suddenly I found there was tremendous itching on my body, and I fainted and I collapsed. And I regained my consciousness, and there were a few pins stuck on my body. And my anaphylaxis had been overcome within a few seconds or a minute or two at the most. So that I got an opportunity to use this in a patient who was suffering from severe asthmatic attack. I was still practicing my medical practice, and in fact, it was a doctor who worked nearby, and she developed a severe attack of asthma, and she got her adrenaline and aminophylline, and she came to my clinic to administer to her, and I gave it to my nursing assistant to load these into and in the meantime, I stuck 2 or 3 acupuncture needles on her, and she did not need those, drugs at all. It definitely worked much faster than those intravenous aminophylline would have done that. So from there on, then I took several courses in China. I went on, and I found that it helped successively in tackling medical emergencies, much faster than the parental administrations. And thereby, it gave me the courage and gradually started using it in the patients. And my practice got shifted from what I practiced as a very well-reputed medical physician to now to the practice of acupuncture. Then it was all the time worrying me how acupuncture works. And eventually found the answer. Acupuncture is nothing but accelerated yoga. It is therapeutic yoga. If yoga is the way of life to keep ourselves healthy, acupuncture helps us to restore that same status, as I said, homeostasis. It restores my milieu interior by restoring what the Chinese have called the yin and yang. In yogic language, we call it the Ida and the Pingla. And in our medical parlance, we'll call it the balance of the sympathetic and the parasympathetic, which unfortunately no drug in the world is dedicated to. So from there on, gradually, and then of course the chronic ailments, as you see, all the lifestyle diseases, etc., remain incurable. the morbidity keeps on increasing, and that's what has encouraged me. And over the years, from the country's who's who, including the families of the President of India, the Prime Ministers of India, the Union Health Minister, Union Health Secretary's wife, and down the line, so many people. It is now, I call it is a, having now practiced it more than 40 years, I say it is a very predictable, reproducible, and sustainable with a high rate of efficiency, and it can be practiced anywhere. Yes, your question, having asked me, what is the most, you see, it's like I was on a high altitude trek to Gangotri back about 30 years ago. And there you have a night halt. And we reached there, and there was a commotion. A man had been brought in who had developed this acute mountain sickness at an altitude of nearly 15,000 feet. He was pale and blue, and there was no medical assistance available. I went and offered my service, and I had no gadgets, nothing with me. And with my bare hands, I tried to do his acupressure or acupuncture. And this gentleman got revived in 10 to 15 minutes. And 20 minutes later, he was sipping tea. And there was a great applause. So that acute mountain sickness fortunately got repeated on 2 successive my trips to Kailash Yatra, as well as to the Everest Base Camp. I went to celebrate my 75th birthday, to test my physical health, to Everest Base Camp, and there also one of the team members developed acute mountain sickness, and we could now, having had the added experience of years, we could cure him, and he could get back safely to his home. So it's amazing. I say everybody who wants to be a good doctor. So then from acupuncture to yoga as a way of life, because I come and patient comes to me, I don't merely relieve their symptom. I must tune them into way of life. The Ayurveda, I don't need to give them any Ayurvedic medicines, because Ayurveda is more about lifestyle. You ingrain them into, while they are undergoing the therapy with you, you teach them the philosophy and the correct practice of yoga. And see, unfortunately, as you all know, yoga has been just made these physical asanas, exercise. And some of these great yoga teachers have done great injustice to this way of life by only enhancing the yoga, asanas, etc., or at the most, the breathing exercises, the pranayama. But the yoga lies in yama and the niyama. And of course, pranayam, asanas, dhyan, dharana, pratihara, leading us to a state of samadhi. But what is most important is the yam and the niyam. So we inculcate that in the patients, and that makes when the patients come, they may be suffering from acute problems, they may be suffering from a range of problems. For example, a diabetic. Now they may come because they have got severe neuropathy. That is one of their greatest problems. The diabetes, with the best of medication, even insulin administration has not got fully controlled. They've developed a foot drop, or they developed symptoms of paralysis, etc. And within next few days, as we get onto this intensive therapy, the blood sugar levels start getting controlled. The patient's dependence on medication, the dose of medication starts progressively reducing, the symptoms start vanishing, and they recover. Now, it
Okay,
is
Dr. Tuli.
definitely very creditable. And that's what
Thank
makes
you.
me what I am. That
You
I
definitely
make a
gave us.
statement today that all diseases at any stage can be reversed. Of course, earlier the better. So let people not wait and aggravate their problems. And we include this. Now, Dr. Gulati said that there is a National Medical Council. You see, National Medical Council is there to control the modern medical system, its practices and its various aspects of this. But our government has followed the national health policy on the WHO recommendation that there should be an approach to health. That's why there's a Ministry of Ayush, that we could make an optimum synergy of all the different systems. And as I said, once the patient is on a allopathic medicine, patient is in a acute state of sickness, in a tertiary under tertiary care, you cannot give any other drug to them in any form. But by regulating the life force, as Hippocrates had identified also, by reinforcing the life force, by restoring the homeostasis. I give the example to my patients. I say, human being is not a machine which cannot correct itself. Human being is a gift of the nature. As you see, you pluck out 90% of a tree, and it will start growing all over given the optimum conditions. So the human being has got infinite condition. I say even the body parts are chopped. I developed various injuries. Given proper care, the human being has the potential of regenerating, rejuvenating, and recovering. And that's where all the degenerative diseases can also be reversed.
All right. So, Dr. Tuli, you gave some of the examples of your experience, and I'm glad to know, oh, Dr. Pandav is here. Dr. Pandav, welcome, welcome. You have to unmute yourself. Unmute yourself, sir. Sir, unmute yourself. Dr. Pandav? Dr. Pandav? Tiwary ji?
Yes, I've done the unmuting.
Thank you,
It takes
thank
time.
you. Oh, we missed you for some time.
It had hypothyroidism, that's why there was a delay.
Doesn't matter. There is a leading question to you.
Yes,
We
sir.
we are discussing holistic medicine, but holistic medicine or any other form of medicine which is being practiced in India, which is being controlled by our regulators, right? And it is important. You know, only last week, didn't you see the newspaper cutting that 42 or something numbers of the practitioners of Delhi are unregistered? That means, Dr. Gulati, if I'm not wrong, these are those one who are unregistered from anipathy and which we call them quacks, right?
Ji, sir. Ji, sir.
I know it because incidentally I was also president of Delhi Medical Council long back, and I know that Delhi is harboring at least 40,000 quacks into vicinity of Delhi, and but at the same time, Dr. Pandav, you are the public health person, and you know the in and out and wish of a general person who is perhaps hello.
Yes.
Yes. And what do you think is the need of holistic, oblique, complementary, or integrative medicine? And okay, we are talking holistic medicine today. Then what is the need of holistic medicine in our society? Say our health program, and you know our health program has been restructured in terms of Ayushman Mandir and so many things. Can you give your comments?
The short, immediate answer to your question is yes. But before that, in all my public speeches, I say things. First, I express my gratitude to Defense Forces, Army, Air Force, Navy. डॉक्टर रवि तुली, हम आपको आप 24 घंटे जाके इसलिए हम सो सकते हैं. So I have my gratitude to you. My gratitude to COVID-19 warriors and my gratitude to the audience for listening to us. A hearty congratulations, Amresh, for organizing this very important seminar in today's environment. Now, I want to share with you one important thing. There is only one system of medicine. I repeat, there is only one system of medicine that addresses your pain and fever and suffering. These are all artificial lines which have been created by people. For people, allopathy, naturopathy, there are 30 types of pathies are there. So there is no dearth of it. But as I said, that there is only one system. Patient has pain and suffering and fever, he needs that to be addressed. Now, in today's environment, I did a study 10 years back on urban health unregistered practitioners staying next to JNU. People have no choice. If you go to All India Institute of Medical Science, New Delhi, you have to spend the whole day to be seen by a consultant. That day's daily wage is lost. So they go to the nearby unregistered practitioners and get treated. So the unregistered practitioner also does not ask money immediately. He can pay in installments. So the reality is, I started thinking on this issue since 1918. And I myself have Parkinsonism since 2016, and I'm taking all systems of medicines. I'm taking allopathy, I'm taking herbal and nutraceutical, I'm taking homeopathy, I'm doing Siddha, I'm doing yoga, I'm doing meditation. So I'm personally doing it, and it has greatly improved my status. Many people don't believe that I have Parkinsonism. And I've introduced a new therapy, music and dance therapy. So in conclusion, I very much warmly welcome and support holistic medicine, complementary and alternative medicine, or integrative medicine. I've written an editorial on this called Integrative Health and Wellness, Time to Integrate Wisdom from Different Types of Medical Disciplines, Public Health or Individual Health. While we try to track him, Achal.
So, ji sir.
I want.
So, I have a few takes on everything, sir. I look at this way. I have a disease process. I have a period which is before my disease process and a period after my disease process. So before my disease process is taken care of by sir, the likes of the preventive and the promotive aspect of the medical care. So that is my aim of trying to see to it that the disease process does not happen. So if I can very well establish the pre-disease process preventive and the promotive aspect, and I prevent the disease, I think a lot of service has been done towards mankind. But not everything is going to be a panacea. I may still have the disease. Now, when I have the disease, I need to manage the disease actively because there are certain diseases which need an active emergency management. Now, let me take, for example, myocardial infarction. I have my heart is going into the coronaries are going into a spasm. There's got clot over there. So I have very little time to see to it that I manage it in the proper manner. So maybe I need a surgical intervention. Maybe I need a cardiological intervention method because their time is of essence. I cannot wait for 1 week, 2 weeks, 3 weeks, 4 weeks. Having managed that problem, then comes the period after the problem. And that again comes into the rehabilitative part. And that again involves the lifestyle management. So before the disease, lifestyle management, after the disease, lifestyle management, in between, if the disease happens, we need to tackle the disease in a very strong manner. Dr. Tuli mentioned something about backache. Now, I have a take on backache. Perfectly fine. We have manipulations. We have very good rehabilitative measures. We have physiotherapy. We have the yoga, the asanas, everything. But having said that, I need to first investigate what was the cause of my backache. Could it be a prostatic malignancy which has metastasized over there? So if it is, my management would be slightly different in a different manner, and I need to tackle it in that particular situation. So I would always need to work on what the diagnosis is and then treat it, take the bull by its horn, and take it to its culmination of proper management. Because no system is perfect. I again say that no system is perfect, but a combination of systems can always be made perfect. I mean, it's not that I say that if I have ENT, I'm an ENT surgeon, and this is what the management is going to be. It cannot be my way or the highway. It is our way and our highway. So all of us have to sit down together and create that highway.
Absolutely. Absolutely.
If I may interrupt, Dr. Achal Gulati, you have put it very explicitly and clear, and I agree with every word and every alphabet that you have spoken. 100% agreement.
Thank you, sir.
Dr. Gulati,
More from my side.
Ji, sir.
can I be heard now? Yes.
Perfect, sir.
I think this is definite that we must, in case of any suffering, we must know why, the diagnosis, because the science has become so advanced. Let me be very frank, even our AIUS system has picked up the diagnostic platform of modern system for the diagnosis. And I fully agree, because then perhaps we are very, very focused what sort of disease we are dealing with. And Dr. Gulati, I fully agree कि हमको बीमारी हो ही ना, उसके लिए हम लोग अपना एक वेलनेस और प्रोमोटिव हेल्थ ऐसा रखें ताकि हम बीमार हैं, लेकिन उसके बावजूद भी बीमारी तो हो ही जाती. And with the increasing age, with the increasing old age, numbers are increasing. तो ओल्ड एज की बीमारी अपनी डेफिनेटली एक टाइम पे आती हैं, बाकी यंगर एज में भी अपनी बीमारी है, हर जगह बीमारियां हैं. अब मुद्दा ये उठता है कि एक तरफ तो हमारे पास ऑल्टरनेटिव ट्रीटमेंट, जैसे तुली साहब ने कहा कि हम एक्यूपंक्चर का एक्सपीरियंस है इनको, और कुछ उन्होंने एग्जाम्पल दिए, लेकिन क्या कोई ऐसी कंडीशन भी है डॉक्टर गुलाटी जहाँ की हम किसी कंडीशन को, जैसे मैं आपसे एलर्जिक राइटिस की आप बात कर रहे हैं ईएनटी के होने के नाते, we cannot treat allergic rhinitis in totality. We can suppress it, we can decrease the symptoms. Can you tell me what can be the complementary part of modern system and our AYUS system so that perhaps the disease can be minimized? At least the patient should be comfortable for years together.
Yes, sir. So, इसके अंदर, sir, what my take would be that the cause of allergic rhinitis, if I look at it, there is an allergen. So I need to identify that. That is where my, if I look at it, the symptomatic control and maybe my immunotherapy, etc., comes into the picture. So my alternative systems which are there, also if you see allergic rhinitis, there are, if I overlap it with vasomotor rhinitis, there are a lot of things which come across as a sympathetic parasympathetic imbalance. Now that is where my lifestyle management, my day-to-day, my yoga management, my lifestyle changing totally, my nutritional issues, my stress management, my, all these areas which need to be augmented along with my treatment and made into a combined effort where we can manage it in the entirety. Ultimately, sir, अगर आपको याद होगा, पहले भी जब हम desensitization करते थे हमारे आयुर्वेदिक के अंदर, we used to give small quantities of the thing with which we got allergic to. एक pinch दे दिया बच्चे को, and over a period of time, the child used to develop the resistance to that. So the same principle, what were there, all systems have got certain things which are good in it. So let us learn to fight any disease symbiotically, that is dependent upon each other, with use of complementation with each other, augmentation, never to replace each other. However, having said that, whatever we do in today's time, sir, with so many regulations in place, I still need to look at evidence-based medicine. So whatever anecdotes I have, I need to convert them into evidence-based, form a series, get my peer review evaluation done, put it into the public domain, and then put it into research so that it is accepted the world over. Let me not waste my my science with just small anecdotal issues. Let me publish the research so that it is of benefit for the entire country and the entire world over there. But at no point of time, sir, every system has got something good. we need to exploit that good in every system. We cannot reject any system outrightly. We need to accept that system, take it in a more scientific manner, and know what do we exactly want. Now, if you see, sir, in biology, I was taught 5 things: why, what, where, when, how. So when these 5 things are answered by anything, I think my problem gets sorted out. So whether it is a Ayurvedic physician or a homeopathic physician or a holistic physician or an integrative physician or allopathic physicians, whatever it is, if we combine our knowledge together, let me tell you, sir, the next Bharat Ratna is going to be for that person who integrates everything.
Then let it go to double helical. Okay, then I fully agree that there is a strength everywhere. We have to find out the strength of each and every system. Each and every individual try to combine it in a manner that, again, I say, the best in the interest of the patient. Right? Dr. Pandav sir, मैं
So,
आपके पास दोबारा आ रहा हूँ. पब्लिक हेल्थ की फील्ड में
the
जो भी आप
RCT, Dr. Gulati
पब्लिक
mentioned about RCT. The highest form of clinical evidence is meta-analysis of RCT, Dr. Gulati.
That's right.
But before and after study with sample size of 1 is also good evidence to begin with.
Yes,
I
sir.
have given my own evidence, Dr. Gulati, that for Parkinsonism since 2016, I'm taking 10 different types of systems of medicine and my recovery has dramatically improved. So the point I want to make, while we look for meta-analysis of RCTs, we must also take into consideration sample size of n equal to 1. That's the point I want to make. Now, the
So
second point
I will just
Yes,
add to
please.
that, sir. You have one episode. There will be many people like you who have also had a similar sort of a thing. So if the pooled data comes across, we convert it into a evidence base over there, and it really helps other people, sir.
Excellent idea.
Here,
I think we should
here
do
I would
that.
like to say, Dr. Pandav, Dr. Gulati, मेरा पर्सनल ऑब्जर्वेशन है, आई होप आई एम नॉट रॉन्ग, कि हमारे पास इतना इंडिविजुअल डाटा है लेकिन हम उसको कलेक्टिव वे में नहीं ला पा रहे.
Absolutely.
So anybody who can organize that small data into a big data and perhaps look into it, analyze it, and come out with your series. Let me tell you one thing. Deep,
No better place than
deep.
Dr. Gulati University. He is the Vice-Chancellor. Let him be the center, India center. Dr. Gulati,
Dr.
you take the lead as Vice-Chancellor.
Dr.
Actually,
Gulati, आपके पास
sir,
challenge आ रहा है.
to be very honest, I have created a center for integrative medicine, yoga, happiness, and wellness. I already created a center with a director over there. Yesterday, I was with the integrative center at Nimhans. I went through that. And with the NMC, we have already proposed an MD integrative medicine. First to start with probably would be the MD integrated family medicine program, because we need to have such programs for it to progress. And let me assure you, sir, within the next year, you're going to see this program come through, sir.
Dr. Gulati, I appreciate your concept of integrative family medicine program. Your points in favor of this program. 1, 2, 3.
Sir, very simple. मेरा भारत जो है वो बहुत ज्यादा एक्सपेंसिव ट्रीटमेंट्स अफोर्ड नहीं कर पाता है बिकॉज ऑफ माई पॉपुलेशन. So my focus has to be on multitude of issues which can prevent and promote a good health care. I still remain within the purview of the WHO definition of health and all the added add-ons to that, so that all aspects of that are created. So in the integrative medicine, we need to have a yoga expert, we need to have an Ayurvedic expert, we need to have an Indian system of medicine person, we need to have an allopathic system. So all the systems combined, which will form the faculty in the center for this center, what I have just told you, with a person who with reasonable the qualification also, so that we can create and build a full-fledged center for helping the population across the country. My country needs a situation which is easily handleable, and with my workforce around, so many workforces around, I think it's not a very difficult job. Today, everybody demands precision, personalization, prediction, prevention, and promotion of every healthcare management system. And all these systems can be brought about once you bring about an integrative medicine, which is part of the holistic medicine. Holistic medicine and integrative medicine will at some time be difficult to differentiate with each other. They will go hand in hand with each other. They are subsets of each other. So I think if we work on with that issue in mind, my problem of having evidence-based research and evidence-based medicine would also be looked after, sir.
मेरी प्रॉब्लम क्या है कि कई बार हम लोग इस चीज को देखने की कोशिश करते हैं, लेकिन हमारा लॉ ऑफ लैंड भी है। आज के दिन हमारा लॉ ऑफ लैंड अलाउ नहीं करता कि यदि मैं एलोपैथिक सिस्टम का डॉक्टर हूं तो मैं अपनी दवाइयां दूंगा, अपना ऑपरेशन करूंगा, लेकिन उसके अलावा मैं कोई और चीज प्रैक्टिस नहीं करता हूं। इसका मतलब मैं उस चीज को रेफर करूंगा एबीसी को, राइट?
सर आज के मैं थोड़ा सा उसमें ऐड करना चाहूंगा। एज पर द आईसीएमआर गाइडलाइंस रिलीज 15 days बैक, एन इंस्टीट्यूशनल एथिक्स कमेटी जब बैठेगी तो उसके अंदर वट एवर सिस्टम यू आर ट्राइंग टू डू, दे विल सिट डाउन टुगेदर ओवर देयर एंड फॉर्म अ फॉर्मुलेशन which will a formula which is going to be both the systems can be practiced under the supervision of each one of the specialists over there, sir. So at least that integration is already on its way on, sir. हर चीज में वक्त लगता है. A progress has been made, a first step has been taken. I think over a period of time we are looking at a breakthrough, sir.
तो इसका मतलब हमको बहुत क्लियर कट वर्ड्स में लॉ ऑफ लैंड चाहिए।
जी सर।
इट रिक्वायर्स लॉट ऑफ क्लियरिटी।
जी सर।
दैट्स वेरी गुड।
और अभी जो कल मेरी बात हुई, जैसे द ट्रांजिशन पीरियड फॉर एनी स्पेशलिटी टू डेवलप, we need to have certain leeways over there, who will be participating, who will not be participating, so that that transition period के अंदर the duties of the different physicians of the different specialities of the different medicine systems which are there, they are being defined so that an integration can be brought about, creating one particular center where we have that, sir.
All right. Tuli sir.
Can I make an intervention?
Yes.
I also taken Russian bee stings for my treatment for Parkinson's. Russian bee sting, I have taken it. My suggestion, Amresh is very much action-oriented. What I would suggest is Dr. Tuli and I can be, if Dr. Gulati can invite us, we would like to spend one day at your institution to share with your team what they are doing. आप हमको न्योता दीजिएगा, हम आपके दरबार में हाजिर होंगे।
जी सर, दिल ने पुकारा, आप चले आइए सर।
डॉक्टर तुली और हम एक दिन आपके साथ बिठाएंगे आपकी टीम के साथ।
तुली साहब,
बिल्कुल बिल्कुल।
तुली साहब, आप डॉक्टर गुलाटी ने जो बताया उसके बारे में आपका क्या विचार है?
बहुत अच्छा बताया।
I think you should be one of the happiest person.
जी,
if this thing comes in a manner that, well, the implementation of the concept of holistic medicine, that is the biggest problem. And once it is there, that acceptance amongst public.
जी,
तो वो भी एक इम्पॉर्टेंट फैक्टर है जिसके लिए कि जब एक बार सिस्टम शुरू होगा तो एक्सेप्टेंस भी आएगी। आप मुझे ये बता दीजिए कौन सा ऐसा बंदा है जो कोई ना कोई होलिस्टिक अप्रोच फॉलो नहीं करता है किसी चीज में?
Life is a wholesome approach.
जी,
There's so many aspects to the life itself, but good health is the need to have a life. Like there is a Vedic saying, धर्मार्थ कामा मोक्षमम शरीरम मूलामुत्तमम आरोग्यम मूलामुत्तमम, कि अगर आपको जिंदगी में कुछ भी पाना है तो उसके लिए एक अच्छे स्वास्थ्य की जरूरत है। और उसमें हमारे देश का जो आज कार्यक्रम चल रहा है, तो उसके लिए सबसे पहले स्वस्थ भारत ही विकसित भारत हो सकता है। तो स्वस्थ भारत वो तब होगा जब उसकी जितनी दवा के ऊपर निर्भरता कम से कम होगी। डॉक्टर गुलाटी ने बहुत अच्छा कहा कि देयर इज ए सिम्बायोटिक रिलेशनशिप। यस, होलिस्टिक मेडिसिन इज सिम्बायोटिक रिलेशनशिप। आपने कहा लॉ ऑफ द लैंड, लॉ ऑफ द लैंड हमारी नेशनल हेल्थ पॉलिसी कहती है देयर शुड बी एन इंटीग्रेशन, बट समवेयर because of lack of expertise and clinical evidence in this, we have lagged behind. And that's where I will like to highlight the difference between holistic medicine and integrated medicine. Now, integrated medicine is we use a combination of all the available systems of health.
Sir, एक second, sir. एक सेकंड
जी
सर, अपन इंटीग्रेटेड मेडिसिन नहीं, इंटीग्रेटिव मेडिसिन की बात कर रहे हैं सर।
ओके ओके यस
They are two different
जी
entities, sir.
जी करेक्ट so that integrated medicine cannot work because you cannot prescribe medicine from different systems to a patient. Now integrative also, अब जो WHO की डेफिनेशन है, आप जानते हैं कि 1986 में वर्ल्ड हेल्थ असेंबली ने कहा था कि ये डेफिनेशन फिजिकल मेंटल सोशल वेलबींग इज नॉट इनफ विदाउट एडिंग स्पिरिचुअल वेलबींग टू इट, जो कि आज तक WHO इंप्लीमेंट नहीं कर पाई बिकॉज ऑफ वट एवर द फोर्सेस दैट गवर्न द WHO. बट हमारा जो आयुर्वेद और योग है दैट फंक्शंस ऑन द स्पिरिचुअल एस्पेक्ट ऑफ हेल्थ. तो इनको, और इसमें हमको कोई दवाई की जरूरत नहीं, तो इट इन नो वे इट कॉन्फ्लिक्ट्स द, बिकॉज कुछ भी आप कहें, हमारी कंट्री में भी 95% ऑफ द बजट इज एलोकेटेड टू मिनिस्ट्री ऑफ हेल्थ एंड ओनली 5% टू मिनिस्ट्री ऑफ आयुष, और आयुष में भी 5 डिपार्टमेंट हैं. तो इट्स लाइक री इन्वेंटिंग द व्हील. पर जो हमारा मिनिस्ट्री ऑफ हेल्थ है, that means जो हमारा health care system is essentially based upon the modern system of medicine, right from the primary, secondary and tertiary levels. Now, we as belonging to the same system, we have to do SWOT analysis. किसकी strength, weakness, opportunities, or what we are trying to achieve. And that can be achieved by adding the spiritual dimension to the WHO definition. अगर WHO खुद कहती है कि there should be an integration, और WHO की जो एडवाइजरी बॉडी है वर्ल्ड हेल्थ अथॉरिटी, वो कहती है कि स्पिरिचुअल के बिना हेल्थ नहीं मिल सकती, और बड़े बड़े साइंटिस्ट ने ये माना है, क्योंकि ह्यूमन बीइंग एट द कोर इज अ स्पिरिट, दैट लाइफ फोर्स which can be regulated. और इन चीजों को अपनी जो मॉडर्न मेडिसिन की प्रैक्टिस में कंबाइन करने में कोई आपत्ति नहीं है. आपने बहुत अच्छा कहा कि आई विल लाइक टू कम, उसका हमें एविडेंस चाहिए, और उसका एविडेंस के लिए यू आर आवर लीडर, लेट अस कम एंड कंट्रीब्यूट आवर experience, expertise to it, and develop scientific evidence, and from there on let us take up with, as I said, my transformation started with 1977-78 when I saw these patients getting well at the army hospital from bronchial asthma and backache. और ये भी मैंने कहा to complement the best practices. मॉडर्न मेडिसिन के बिना हमारा गुजारा नहीं, वही हमारा आधार है. हमारे देश की जो स्वास्थ्य सेवा है उसी के ऊपर निर्धारित है, पर उसको इंप्रूव करना है, उसके अंदर जो कमी है, जो कमजोरी है, उसको हमने उभारना है, ताकि हम इस देश में स्वस्थ भारत ही विकसित भारत हो सकता है. हमारा खर्चा दवाई के ऊपर नहीं, सेहत के ऊपर हो. आज
बिल्कुल सर,
आज जो आयुष्मान भारत है वो 5 लाख रुपए की आपको फ्री फैसिलिटी देता है बीमारी का इलाज करवाने की, पर आपको वो फैसिलिटी नहीं देता कि आप बीमारी से बचने के लिए भी कुछ कर सकते हैं. इस
सर
चीज
आपने
को
तो सिर्फ स्पिरिचुअल ऐड किया सर, मैं उसमें
जी
इमोशनल, एथिकल, फेमिलियल ये भी ऐड करना चाहूंगा उसके अंदर बीच में.
जी
तो
जब जो इंसान स्पिरिचुअल है वो एथिकल होगा ही,
वो बड़ा मुश्किल,
उसकी
और स्पिरिचुअल
इमोशनल
दोनों
हेल्थ,
जो है वो,
उसकी इमोशनल हेल्थ अच्छी होगी ही.
फिर भी बोलना पड़ेगा. You have to be very explicit about it and don't put it in one word, spiritual. You have to explicitly say that is emotional.
और spiritual health is automatically also financially healthy.
बट कुछ भी कर लेंगे सर, जब हमको कुछ भी करेंगे, हमको जो सेफ्टी वाला है, देयर आर सर्टेन इश्यूज व्हिच नीड टू ऑलवेज बी कंसीडर्ड, वेदर इट इज एलोपैथिक, आयुर्वेदिक, होलिस्टिक, स्पिरिचुअल, जो भी हम मेडिसिन की बात करते हैं, कि वेदर is there any potential for harm in that situation? Whatever we are managing, however we are managing, there should be no potential for harm. Let us say emergencies need to be looked at with whatever are the standard operating procedures. अब आप देखते हैं इतनी सारी डाइट्स हैं सर, फैट डाइट्स हैं which have, you see,
सर ये सब कमर्शियल खेल है, ये सब कमर्शियल है.
बिल्कुल सर, मैं यही कह रहा हूँ कि हमको ये कमर्शियल, बिकॉज इट्स वेरी डिफिकल्ट थिंग टू डिफरेंशिएट बिटवीन अ क्वैक एंड अ प्रोफेशनल, दैट नीड्स टू बी डिफरेंशिएटेड, एंड दैट इज वेयर दीज डाइट्स, दीज मैनिपुलेशन। दूसरी चीज आपने कॉस्ट के बारे में बोली, हमारी कोई भी इंश्योरेंस कंपनी प्रिवेंटिव प्रोमोटिव को कवर नहीं करती है सर, वो खाली क्योरेटिव को करती हैं। सो वी नीड टू ब्रिंग दैट इनटू द सिचुएशन। सो इंश्योरेंस कंपनीज डोंट कवर, the supplements are not covered by those, the conflicts are there in these companies when they are looking at these all these things. And
And
also
health,
हमें, we have to get across one thing, there are a lot of lifestyle diseases, but lifestyle diseases need to alter our lifestyle, but we need to maintain the proper functioning of that, which would be possible. Not let us say knee replacement है सर, मेरी knee के अंदर I don't have a cartilage, I don't have any fluid, I don't have any synovium over there, so at best I can only give you pain relief. But my question is, if I need a knee replacement over here, I need a knee replacement over here,
correct?
but that has to be
That's why,
supplemented with lifestyle management, my weight loss, my exercise, that has
that's
to
why
be done. So
it's
there is no
complement.
one
Yes,
system. There is no one system which is the best system.
absolutely,
We have to
absolutely.
look at all the systems without
Yes.
criticizing any other systems.
No, not criticizing. It's like the holistic medicine. 2002, the
Absolutely.
British Medical Journal. In 2002, British Medical Journal brought out a special issue dedicated to this integration, and it said this is an exercise towards complementing the strengths of the various systems to help us overcome their inherent weaknesses.
बिल्कुल सर, क्योंकि कोई भी मेरेकल क्योर नहीं है सर कहीं पे, कोई भी
नहीं,
100% क्योर नहीं है सर कहीं पे, nobody can give 100% assurance.
हम तो
जिंदगी में कोई
कॉम्प्लीमेंट
कहता है
कर रहे
सर,
हैं।
डॉक्टर
अगर
गुलाटी।
कोई कहता है सर, मैं सर एक सेंटेंस बोलना चाहूंगा,
हाँ बिल्कुल बोलते
इंसान कहता है 99.999% सक्सेस रेट, लेकिन वो 0.0001 कहीं ना कहीं तो हुआ ना किसी के साथ,
और
सो
वो बार
इट कैन
बार
नेवर
आती
बी,
है,
वो
और वो
बार बार
बार
आती है
बार
सर।
आती है।
बिल्कुल सर।
मैं ये
एक
कहना चाहता हूँ, मैं आप तीनों एक्सपर्ट से मैं बात कर रहा हूँ, सबसे बड़ा मुद्दा निकल के आता है कि अपनी स्ट्रेंथ को अप्रिशिएट तो हम सब करते हैं, अपनी वीकनेस को हम अप्रिशिएट शायद करने की टेंडेंसी नहीं रखते। जिस दिन हम अपनी वीकनेस को एक्सेप्ट करके बता सकें कि ये यहाँ पर मेरी वीकनेस है, एंड वीकनेस यदि है तो कैन एनीबडी हेल्प मी, कोई कोई दिक्कत नहीं है यदि आप अपनी वीकनेस के लिए, यदि आप कहीं फंस गए हैं, आप क्या हेल्प नहीं मांगते? तुली साहब।
सर, मैंने पहले ही कहा हमें अपने प्रोफेशन की स्वॉट एनालिसिस करने की जरूरत है। वी नो आवर स्ट्रेंथ्स। अब हम ये नहीं कहते कि और मैंने ये भी कहा कि हमारी 95% जो हेल्थ केयर प्रणाली हमारे देश में इस सिस्टम के ऊपर आधारित है। तो पर इसकी जो कमियां हैं, जो इस यही तो स्ट्रेंथ, वीकनेस, अपॉर्चुनिटीज एंड रेमेडीज, उसको हमने उभारना है। हमारा काम जो हम कर रहे हैं, हमको उससे बेहतर करना है। उसको बेहतर कैसे किया जाए जिसमें हमारा नुकसान भी ना हो और फायदा भी हो, चित भी मेरा पट भी मेरा। तो
बिल्कुल
दिस
ठीक है।
इज व्हाट द ड्रग फ्री modalities, when we complement, it helps us even at the tertiary care stages, at every stage of health. And if but we cannot forget the good that modern medicine is doing to people. हाँ, इसको
दैट गोज विदाउट सेइंग।
मेरे मेरे विचार में सर, जो आज मेडिकल इंटरवेंशन है, इसको कैन बी ब्रॉट डाउन सिग्निफिकेंटली बाय रीइंफोर्सिंग आवर प्राइमरी हेल्थ केयर विद दिस ड्रग फ्री मोडालिटीज। इसमें बहुत जरूरी है कि जो हमारी हेल्थ एजुकेशन है, स्कूल हेल्थ एजुकेशन, वहां से बच्चे की सेहत का सुधार होना शुरू होना चाहिए। इट शुड बिकम ए वे ऑफ लाइफ, नॉट फॉर दैट दे हैव टू कम टू द डॉक्टर्स।
एक
स्कूल
लाइन
हेल्थ,
तुली साहब,
हेल्थ
एक,
एजुकेशन।
हाँ एक लाइन मैं आपको बता दूं, जो आप तो ज्यादा विद्वान हैं आप सब लोग, जो सुबह में सिमरन करे उसको
बिल्कुल,
दुख
सुख
काहे
में
को
सिमरन
हो।
जो करे, दुख काहे को हो। और हमारी फौज में कहते हैं, दोज हु स्वेट इन द पीस टाइम डोंट ब्लीड इन द वॉर।
सर लीगल
तो
लैंग्वेज हम कहते हैं एंटीसिपेटरी बेल सर।
अब एक
तो
लास्ट एस्पेक्ट में और
संगीत
लेना
के
चाहूंगा,
लैंग्वेज में बोलते हैं।
एक लास्ट एस्पेक्ट और लेना चाहूंगा, वो है डाइटरी एस्पेक्ट। जो भी आप कहिए, हवा, पानी और खाना, ये तीन चीजें ऐसी हैं जो कि हमारे शरीर को इफेक्ट कर रही हैं, ठीक है जी। हवा हमारे बस में नहीं है। अब यदि मैं दिल्ली में हूं तो दिल्ली में ही रहूंगा, मैं छोड़ के नहीं जा सकता। मुझे जो दिल्ली में पानी मिल रहा है मुझे वही पीना पड़ेगा। उसको मैं कैसे ट्रीट करूं वो बात दूसरी है। खाना जो है ये हमारे बस में है। जो चेंजिंग पैटर्न ऑफ फूड है आजकल, स्पेशली आई एम टारगेटिंग आवर यंगस्टर, और उसमें जो हमारा डाइटेटिक सिस्टम वर्सेस आयुष आहार, उसमें जितना मैं स्टडी करता हूँ आई फाइंड दैट आयुष आहार इज वेरी वेरी थेरापेटिक। इसके बारे में डॉक्टर पांडव आपका क्या विचार है?
I totally agree with you. Millets, 2023 was the year of millets.
दैट
Historically, we have been consuming millets since last 5,000 years. Wheat was introduced in India only in 1890. And now I'm leading a movement of stop eating wheat and focus on millets. राजस्थान में तो मिलेट्स बहुत अच्छे होते हैं, हमारे महाराष्ट्र में ज्वारी बहुत अच्छी आती है, तो focus on millets. So nutrition is a very critical part of making a well-being. Over.
अचल जी, आपका क्या विचार है डाइट के बारे में?
सर बिल्कुल आप सही कहते हो सर। हवा तुम जो है मेरे को वही मिलेगी सर, पानी जो है मुझको वही मिलेगा, लेकिन डाइट सर कुछ भी कह लो सर, खाने में ना मजा बड़ा आता है सर। और ये एक ऐसी चीज है जो कि चाहे मैं हेल्थ, जितनी चीजें मजा आता है खा के वो सारी अनहेल्दी हैं सर। लेकिन things do keep on working, sir. We need to incorporate a healthy diet, and there are no dearth of good advices regarding the healthy diets which are there. But at no point of time, again, I will say that diet is the only solution for everything. We need to have for weight loss. Only diet is not going to work out. If I need to have a knee replacement, I need to have my good body, good weight loss also. But only diet is not going to help it because my physical exercise, my motions have to be brought. So again, over here, integration has to be brought out. A good diet is important. A healthy diet is important. The fast food culture which is there, I think over a period of time, it is already on the dwindling now. People are realizing the follies of that. And I think some time will come that we would realize actually what is a good diet and what is a healthy diet.
So I will like to give one point. प्रोफेसर अग्रवाल ने कहा हमारा हवा, पानी और भोजन ये हमारी सेहत को इफेक्ट करता है. सर, आई विल लाइक टू इंटरलेक्ट हियर that what is most important is the emotions of the people. The pollution starts in the mind. If my mind is wrong, all my choices will be wrong. Whether
आप
it
मेंटल
is
हेल्थ की बात कर रहे हैं?
no, sir, spiritual health.
नहीं,
If
मेंटल हेल्थ और
spiritual,
स्पिरिचुअल भी तो लिंक्ड है
spiritual
ना।
wellness controls my emotions and my mental health, and thereby my physical health. Human being is a spiritual being at the core. As Lord Shiva said, without Shakti I am Shav. That Shakti is my life force, which Hippocrates said is the greatest factor in my getting well. Because if I am spiritually healthy, all my actions, all my yam and niyam, the yoga lies in the yam and niyam. That will be healthy. The whole society, the whole universe will reform. And that is the purpose that our Prime Minister's campaign of has brought yoga as a International Day of Yoga, a universal recognition from everywhere. Yoga is to nourish your spirit, keep the harmony between the microcosm and the macrocosm, or the Jivatma with the Paramatma is the nature's intelligence which governs us. We have to be in alignment with that nature's infinite intelligence which knows us, which makes me grow from a microscopic cell, seed of my mother and father, to a great human being. That is the nature. We have to understand and respect the nature's intelligence.
डॉक्टर अग्रवाल
डॉक्टर
सर, अमरीश
गुलाटी,
जी, अगर आप
हाँ
सर अगर
बताइए।
आपकी इजाजत सर अगर आपकी
नहीं नहीं,
इजाजत हो तो
मैं सिर्फ आपको बिल्कुल परमिशन मिलेगी। मुझे
जी सर।
अपना 90 सेकंड का मैसेज दे दीजिए कि आप क्या चाहते हैं इसमें। 90 सेकंड्स में आप फिनिश कर।
मैं चाहता हूं कि मेरा देश सारा स्वस्थ रहे, अच्छा रहे सब। एक मैसेज नहीं, जो हमारे जो भी हमारी ब्रांचेस हैं हमारी, उसमें हमारे जो स्किल्स हैं वो फॉसिलाइज्ड नहीं होने चाहिए हैं। देयर स्किल्स मस्ट बी जो हमारे पुराने जमाने में, अगर चाहे मैं आयुर्वेदिक देखूं, हकीम देखूं, नीम, जो भी देखूं, उनके पास एक क्लिनिकल स्किल्स थे which are today being fossilized. Today is a symptomatic treatment. We need to get out of that. A wrong message should never go out that this system is the best. We need to do our research on which system is the best, pick and choose whatever gives me the best options for my health. And the message should not go out, a wrong message should not go out, because any treatment which is delayed due to a wrong message going out is going to be detrimental and harmful to my health and my outcomes of my disease process. So this is my only message. My main message is, let us go about respecting everybody, every person's skill, every person's knowledge and his science, what he's practicing, sir.
So we want to give respect to each and every system,
Sir,
but at the same time, we like to bring maximum possible evidence-based system,
absolutely, sir. Bilkul,
which
sir.
perhaps brings us to a global acceptance,
Yes.
right?
जी सर. सर अगर आपकी इजाजत हो मैं साइन आउट कर जाऊं सर.
Ji, Dr. Gulati, thank you very much for being with us. I know that you have to leave and be somewhere at
जी सर.
11:30.
जी
So
सर.
thank you
Question,
very
sir.
much.
We have
Your
question for you.
efforts, I'm sure
But
we all are looking towards your efforts in this particular field.
Thank you
before
so much.
For
before
being with us.
before Dr.
Doctor,
Gulati leaves,
please,
I
we
repeat
have also question for you.
Just
I
a
repeat
minute.
Dr. Pandav's request to him to invite us to his university and
Sir,
visit your
we'll work out
department.
something, sir. We'll work out something, sir.
Ji.
जी sir. Thank you, Amresh ji. Thank you, Pandav
Thank
sir.
you.
Thank you, everybody.
Sir,
Thank you, all the
sir,
audience who are
I'm
looking.
going to a question for you. That's from the audience. Please be sit there,
जी.
doctor. Let me, Dr. Agarwal, will you allow me? Then I will raise a
Please,
question.
आप जल्दी से कीजिए.
Sir, this question from Rajesh Verma. He's an NT specialist. He's asking especially, this question goes to you. What with your experience in both conventional medicine and academia, how can holistic practices complement modern ENT treatments? Are there any specific holistic approaches you recommend for ENT disorders? What would you say, sir?
मैं तो एक ही बात बोलूंगा. Keep your mind broad open, think out of the box, respect each specialties, get the best out of every specialty and incorporate it into your own. That is my only request to everybody.
Thank you, sir, very much. Thank you.
तो सर मैं इजाजत चाहूंगा आपसे. I'll be
Thank
signing
you.
off, sir.
Thank you,
जी.
Dr. Gulati.
जी सर. जी सर.
Ji, Dr. Pandav.
Problems that take up the modern medicines. I am just asking as an audience, ये करिकुलम में भी होना चाहिए ना डॉक्टर्स को ट्रीटमेंट में जब हम मॉडर्न मेडिसिन में जब नए नए डॉक्टर बनाते हैं तब.
Abhaji,
हाँ जी.
we will get back to you. Just give me 2 minutes. Just give me.
Sure.
Sir,
Dr.
my
Pandav,
answer is, I would like
last
to say
word on
in the
this
form
topic
of
from your side.
in the form of a song, Pandit Bhimsen Joshi, Vile Sur Tumhara.
और हमारा मिले सुर तुम्हारा और हमारा.
Deep.
That is the answer I want to give it in the form of a song.
बहुत अच्छा, बहुत अच्छा. Dr. Tuli.
जी. सर्वे भवन्तु सुखिना, सर्वे संतु निरामया. ये प्राप्त करने के लिए हमें एक दूसरा वैदिक मंत्र, तमसो मा अस्तो मा सद्गमया, तमसो मा ज्योतिर्गमया, मृत्युत मा अमृत गमया. तो इस को पाने के लिए हमें अपने स्वास्थ्य को स्वस्थ रखना है और वो किसी दवा प्रणाली से नहीं आ सकता. इट हैज टू बी health education right from the school on to the university and to the medical. Yes, when things have gone wrong, we need to take care of that, but 80% of our health will lie in the primary health through health education, and that will reduce load on our tertiary care. So our tertiary care will become even more efficient and not because today the crowds are so much in the tertiary care that it loses its quality. The quantity takes off the quality from there. That will help the people the best.
Thank you,
and
Dr.
I am healthy if I am on no medicine. As WHO says, health is not merely absence of disease, but a state of positive wellness, body, mind, and soul.
Absolutely correct. Now, Tiwari ji, can I
Yes,
request आभा जी अपने को ऑन कीजिए,
हाँ यस सर. सर
बताइए।
एक साइकोलॉजिकल एस्पेक्ट होता है कभी भी मेडिसिन में, कि हम ये कहते हैं कि कभी किसी डॉक्टर की मेडिसिन लगती है, किसी की नहीं लगती है, बिकॉज वो एक पॉजिटिव अफर्मेशन से जाते हैं. सो एक फिजिकल बॉडी में, मतलब फिजिकल एस्पेक्ट के अलावा देर आर मेनी थिंग्स विच गोज विद अस. सो ये चीज अंडरस्टैंड मैंने अपने फादर के केस में देखा था. और यू मस्ट हैव सीन एक एमबीबीएस मुन्ना भाई, एक
जी,
मूवी है मुन्ना भाई एमबीबीएस.
बहुत फैक्चुअल चीज है वो।
हाँ जी, उसमें वो डॉक्टर नहीं है, बट ही ट्रीट्स द पेशेंट्स विद लव एंड केयर. और वो डांस करते हैं और वो जो पेशेंट्स होते हैं वो ठीक हो जाते हैं. ऑल्दो वो मूवी है, वो बहुत आउट ऑफ बॉक्स है. अभी उसको अंडरस्टैंड करने के लिए हमें बहुत ज्यादा उसको उसकी तरह में जाना पड़ेगा. बट ये बात सच है कि बॉडी के अपने हीलिंग मैकेनिज्म्स होते हैं और उसी को डेवलप करा जा सकता है. जैसे मैंने अपने फादर के केस में देखा, मेरे फादर 40s में एडमिट थे. 1 महीना वो एडमिट रहे, खराब होते जा रहे थे. बट और मैंने उस समय बुद्धिज्म चैंट किया. ही वॉज इन आईसीयू. अब डॉक्टर्स का आप लोगों को सबको सिस्टम पता है, वो नॉर्मल वार्ड में शिफ्ट नहीं करते थे या वट एवर द रीजन भी. तो वो उसमें उनको होता क्या था कि मैं चैंट करती थी उस समय. चैंट करने से आईसीयू में जितने पेशेंट्स थे वो सारे के सारे मॉडर्न नॉर्मल वार्ड्स में शिफ्ट हो गए. बट पापा मेरे नहीं हो पाए, उनको चैंटिंग. पर ये बात था कि जहां डॉक्टर्स कहते थे कि भाई ये जिंदा नहीं जाएंगे, हम उनको वापस ले आए. घर में उन्होंने प्राण त्यागे, बट ले आए हम उनको वापस. और उस समय डॉक्टर्स का क्या सिस्टम था, वो बार बार चेंज करते थे. अभी 1 घंटे में आए, अभी स्लीप पोजीशन चेंज करनी है, फिर स्लीप पोजीशन चेंज करनी है. तो वो बॉडी को मौका ही नहीं देते थे. स्लीप इट सेल्फ इज वेरी बिग हीलर. तो वो मौका ही नहीं देते थे कि वो बॉडी अपने आप हील भी करे. वन मेडिसिन आफ्टर अनदर, अनदर मेडिसिन आफ्टर अनदर. तो वो चीज जो थी वो बहुत इंट्रिकेट थी. उसके लिए मैंने उनको उस समय में, आज से 2019 की बात है, बहुत कन्विंस करने की कोशिश करी सर कि इसके साथ में बहुत सारे और पैटर्न्स हैं जो मेडिसिन के साथ हैंड इन हैंड जाने चाहिए. बट दे वर नॉट, दे वर सो मच
आभा जी,
फिजिकल.
मैं
फिजिकल
बिल्कुल आपकी बात समझते हुए, आपकी बात को मैं समझ सकता हूँ, फील कर सकता हूँ।
ये न मॉडर्न जो बच्चे तैयार हो रहे हैं उनको जरूर ये एक आपके करिकुलम में ये एक होना चाहिए हिस्सा, कि वो एक्चुअली बॉडी को समझे कि फिजिकल बॉडी तो सबसे बाद में है. देर आर 5 मेनी बॉडीज उसके अलावा उसके साथ में है. अभी
ये
सर योग,
बात,
सर योग की
आभा जी,
बात.
मैं सिर्फ ये कहना चाह रहा हूँ, जो आप कह रही हैं ये हम सब के दिमाग में है। ऑलरेडी एक गवर्नमेंट की पॉलिसी होती है, जिस पॉलिसी के तहत हम लोग काम करते हैं, और गवर्नमेंट भी इस पॉलिसी को समझती है। और जहाँ तक मैं कह सकता हूँ कि गवर्नमेंट आपकी बात का जो कहने का एक्सट्रैक्ट है कि हमारे यंग डॉक्टर्स को भी जो मॉडर्न सिस्टम से हैं, इस माइंड बॉडी जो हेल्थ का एस्पेक्ट है, स्पिरिचुअल एस्पेक्ट है, और जो मेंटल एस्पेक्ट बड़ा इम्पोर्टेंट है। जैसे आपने बताया कि आप आईसीयू में
चैंटिंग करते थे.
चैंटिंग चैंटिंग से जो सूदिंग इफेक्ट आता है, माइंड को जो कूलनेस मिलती है, वो हम सब जानते हैं। एंड आई विश कि आज नहीं तो कुछ सालों के बाद ये हमारे सिस्टम में एक पार्ट बनना चाहिए, करिकुलम का पार्ट बनना चाहिए। ठीक है जी। एंड पर जो आज की एक्सरसाइज डॉक्टर मिस्टर तिवारी ने अरेंज की है, ये एक तरीके से प्रीकर्सर है हम लोगों को सोचने के लिए इन ए ग्रुप कि ये होना चाहिए। एंड आप भी इसके साथ हैं, ये सुन के हमको बहुत अच्छा लगा। एंड हम सब लोग कोशिश कर रहे हैं और करेंगे ताकि ये एक टोटल होलिस्टिक अप्रोच बने।
हाँ
sir.
सर, होलिस्टिक जैसे चक्रा मेडिटेशन है या चक्र पे ध्यान देना है, देर आर 7 चक्रास. तो वो चक्रा में जो ब्लॉकेजेस हैं वो भी दे शुड गो हैंड इन हैंड विद द मॉडर्न मेडिसिन.
Yes,
मॉडर्न
my
मेडिसिन.
dear, दिस
Immediate
इज व्हेन वी, जब हम होलिस्टिक जाते हैं तो हम ये हमारी यौगिक प्रणाली है, आपका जो मंत्र है ये भी हमारे योग का सिस्टम है। तो ये सब चीजों के ऊपर हम फोकस करते हैं। और दूसरा, कहते हैं ना कि बहुत सारी पैथी हैं, जो
बहुत
सबसे बड़ी पैथी, वन ऑफ माय प्रोफेसर्स यूज्ड टू ऑलवेज से कि बहुत पैथी है, सबसे बड़ी पैथी है एम्पैथी।
सर, हैप्पीनेस पैथी जो है ना सबसे बड़ी है।
एम्पैथी, यस।
यस।
आप एम्पैथिक होंगे, आप खुद खुश होंगे, आप दूसरों को खुश रख सकेंगे।
हाँ सर।
आप खुद,
So I
आप
think
पहले डॉक्टर को खुद स्वस्थ रहने की जरूरत है, तभी वो लोगों को स्वस्थ रख पाएंगे।
मेरे ख्याल में हमारा टाइम आज के
Yeah,
डिस्कशन का पूरा हो
time
चुका
is
है,
over.
इसलिए मैं डॉक्टर तिवारी जी आपको हैंड ओवर करता हूं कि
Yes.
आप कोई और क्वेश्चन है।
This is my single question from Dr. Tuli. Dr. Tuli, as you know that we have shortlisted some questions, and this question especially for you.
जी
Could you tell us this question read by Priya Sharma, medical student, she is from the Medical College of Delhi. She is asking, could you tell us, as the father of holistic medicine in India, as you claim, how do you see the future of holistic healthcare in India mainstream medical system? What steps are needed for better integration?
See, the future of holistic medicine, this lies with the public. As in his opening address, Professor Agarwal said कि इसकी जरूरत और डिमांड हर तरफ बढ़ती जा रही है। तो जिस चीज की डिमांड होगी उसी की सप्लाई होगी। आज मुझसे अक्सर पूछा जाता है कि होलिस्टिक मेडिसिन इतना लाभदायक है तो लोग इसको समझते क्यों नहीं है। हाँ, वो चेतना जाग रही है, हमको उसकी सर्विस प्रोवाइड करनी है। उसके लिए हमको डॉक्टर गुलाटी के साथ तय हुआ कि हमें उसका एविडेंस, क्रेडिबल साइंटिफिक क्रेडिबल एविडेंस बनाना है। तो ये जब सब लेके आएंगे, इसकी शुरुआत हो चुकी है। इसकी शुरुआत हो चुकी है कि लोगों को उसका फायदा पहुंच रहा है, परंतु उसकी सुविधा भी नहीं प्राप्त है और उसके लिए एविडेंस भी हमें अपनी तरफ से ये देना है। तो ये मिलके जो, अगर हम स्वस्थ भारत का प्रचार करते हैं तो उसके लिए हमें, जैसे हेल्थ की डेफिनेशन है, नॉट एब्सेंस ऑफ डिजीज बट स्टेट ऑफ पॉजिटिव वेलनेस, और वो सिर्फ एक हेल्दी लाइफस्टाइल से आ सकता है, जो कि स्कूल से शुरू होना चाहिए और मेडिकल करिकुलम में भी आना चाहिए। और हर डॉक्टर को ये सोचना चाहिए कि मैं अपने पेशेंट को बिना दवाई कैसे ठीक करूं, जिसको बोलते हैं कंजर्वेटिव मेडिसिन। इट इज ए वेरी मच पार्ट ऑफ द मेडिकल करिकुलम, ना कि लोगों को मैं जल्दी से जल्दी इमरजेंसी में, हाँ, जानलेवा बचाव के लिए जो दवाई लेनी है वो जरूरी है, मगर जो लाइफस्टाइल डिजीज है वो सब बिना दवाई के ठीक हो सकती हैं और उसके लिए डॉक्टर्स को प्रोएक्टिव होना पड़ेगा।
Thank you, sir. Thank you.
एक one
Thank
more
you.
thing.
Yes, wait. Let me finish one by one. Then you are welcome to raise any question. Now this question goes to Dr. C.K. Pandav, Chandrakant Pandav Sahab. He's an expert of the public health and he's a former HOD of community medicine, all institute of medical science. Sir, could you tell us, as a public health expert, how can holistic medicine contribute to addressing the large-scale health challenges such as malnutrition and holistic diseases? What will you say?
Dr. Gulati also mentioned about this, that the focus has to be on preventive and promotive activities of spectrum of health management. So you have to do major focus on diet and nutrition and Ayush activities. Yogasana is very important for these activities. So that should be a major focus on primary preventive activities that will keep you away from getting diseases. That's my answer.
Sir, this question, our moderator, Dr. Arun Agarwal, could you tell us, sir, are you getting me? Dr. Arun Agarwal Sahab, this question is especially for you.
Yes.
Could you tell us, many practitioners and policy makers will see holistic medicine as an alternative rather than a complementary approach. How would you see, how can we bridge this gap to create a more integrated healthcare system? What's your idea? You are very
देखिए,
expert.
ये पूरी एक समझने की बात है और आप आपस में ये समझ के लिए बेस्ट पॉसिबल क्या कर सकते।
Yes, sir.
तो यहाँ पर मरीज के लिए बेस्ट पॉसिबल सॉल्यूशन निकालना है हमें। उसको मरीज को एनालाइज करते हुए, उसकी कंडीशन को देखते हुए, जो भी हमारे पास डिफरेंट ऑल्टरनेटिव्स हैं, चाहे वो एक्यूपंक्चर हो, चाहे हमने अभी बताया आभा जी ने कि हम कोई भजन या कोई सा भी ऐसा संगीत जो
चक्र
कि उनको
टिंग
एक सूदिंग इफेक्ट दे, चाहे एक्यूपंक्चर हो, चाहे वो हमारा आयुर्वेदा हो, हर चीज की अपनी स्ट्रेंथ है। एक
Yes, sir.
स्ट्रेंथ को यूज करने के लिए हमें एक एक प्लेटफॉर्म बनाना पड़ेगा जो कि एक बेस्ट पॉसिबल स्ट्रेंथ को, जैसे आप कोई मिक्सचर बनवाते हैं ना, जैसे दुकान पे जाते हैं भाई मिल्क शेक बनाना है, तो मिल्क शेक अच्छा ये भी डाल दो, ये भी डाल दो, ये भी डाल दो, क्योंकि हमको जो टेस्ट पसंद है वो हम सब डलवा लेते हैं, उसके बाद उसको एंजॉय करते हैं। ऐसे ही हम मेडिकल प्रोफेशन का क्या फर्ज है कि वो सब चीज़ें पिकअप करें कि जो पेशेंट के लिए बेस्ट है उसको पिकअप करें, उसको पिकअप करके उनको बेस्ट पॉसिबल। अब उसके अंदर बहुत सारे सवाल उठते हैं, ड्रग इंटरेक्शन और ये सब चीज़ें, ये कुछ हैं, कुछ हम लोग एक्सप्लॉइट करते हैं, लेकिन अल्टीमेटली उसके लिए हमें एविडेंस बेस्ड कुछ सिस्टम करने हैं। आयुर्वेदा की यदि मैं बात करता हूँ तो आयुर्वेदा में सरफेस थेरेपी है विच इज सेफ, पंचकर्मा इज आल्सो सेफ, मेडिसिन जो उनके फार्मास्यूटिकल इंटरवेंशन है उसके लिए मॉडर्न सिस्टम के डॉक्टर बड़े एप्रीहेंसिव रहते हैं, बट इन माय पर्सनल ओपिनियन मोस्ट ऑफ द ड्रग्स आर वेरी सेफ। लेकिन
So
ये हमको हमको
so
अपने
body,
आप को, तो ये
तो क्या
जब तक
सर?
तिवारी जी, उसके लिए पहले एक लीगल सिस्टम लाना पड़ेगा ताकि जो भी बंदा उसमें इन्वॉल्व हो, चाहे मैं हूं या डॉक्टर तुली हो, डॉक्टर पांडव हो, डॉक्टर गुलाटी हो, वो कह सकते कि यस वी आर डूइंग इट। ठीक
Hello.
है।
Yes, sir. Yes. Now anyone can raise the question.
आवाज
सर
आ
यस सर, एक था होलिस्टिक मेडिसिन जो हम डिस्कस कर रहे हैं यहाँ। आई थिंक गोइंग बियॉन्ड द बॉडीज वाली बात है। कई बार जैसे वो मेरे फादर को कहते थे मेनिंजाइटिस है, मेनिंजाइटिस का टेस्ट करो। अब ऑलरेडी पेशेंट है, उसको आप स्पाइन में से फिर से, जबकि ऑन द देख करके ही पता चल रहा है, वो बड़े सीनियर डॉक्टर्स थे और देख के ही पता चल रहा है कि मेनिंजाइटिस नहीं है। मैं कहती थी भाई नहीं है आप, बट वो टेस्ट टेस्ट आफ्टर टेस्ट, टेस्ट आफ्टर टेस्ट, टेस्ट, और वो पेशेंट की हालत खराब ही होती जाती है। सो होलिस्टिक मेडिसिन जो है ना विल गिव यू इनसाइट कि गोइंग बियॉन्ड द बॉडीज, जैसे हमारे ऋषि मुनि वगैरह जो थे नर्व्स देख के पता चला लेते थे ये प्रॉब्लम है और ये उपचार होगा। एंड सेकेंडली आई थिंक हमने कॉपी कर रहे हैं ये जो अनहेल्दी फूड। नो फूड इज अनहेल्दी। आई थिंक हम वो जब चाइनीज फूड ले रहे हैं तो उसके साथ वो रफेज एलिमेंट बहुत इन्वॉल्व करते हैं। दे ईट लॉट ऑफ वेजिटेबल्स एंड फ्रूट्स बट वी डू नॉट, हमारे यंगस्टर्स लेते नहीं है, इसीलिए दैट हार्म्स। तो ये एक अच्छी वाइब्रेशंस भी दे। जो खाना हम खा रहे हैं इट्स वेरी सेक्रेड। कम खा रहे हैं ज्यादा खा रहे हैं वो अपने लाइफस्टाइल्स के हिसाब से हो सकता है, बट कभी भी हमें खाना कोई अनहेल्दी नहीं है सर। आई दैट इज व्हाट आई बिलीव इन।
अच्छा आभा जी, आपकी बातों को
Can I
गंभीरता से
speak?
लिया जाएगा। Only
Tuli साहब, can I speak?
जी जी
फर्स्ट ऑफ ऑल सबको नमस्कार प्रणाम। मैं डॉक्टर राजेंद्र सिंह, क्या
वाह,
कैन यू हियर मी?
Yes, sir. Please.
वेलकम वेलकम
I am,
वेलकम डॉक्टर शिवम।
I am Dr. Rajendra Singh, retired. I was working as a professor head of urology and I have trained the doctors, surgeons in the stream of urology from Ladakh, right in the south, Karnataka, so on. So I am a avid practitioner of yoga for last 25 years. I am now 74, running to myself in the Tuli mat in Delhi during a sexual health seminar organized by Rajiv Sood. And today's seminar, he sent me the message, and I thought I must join, but there was an interruption for me because the ISKCON people came in my house about half an hour ago, so I had to leave. But it was really interesting. Regarding the our science, the Ayurveda, which I am very fond of, what happened when the Mughal ruled us for 600 years and another 300 years by Victorian rule, they were not supported by the state. So it took a back bench. Really, the naturopathy and this yoga, which I have been doing for last 25 years, until now I am operating. I am doing TURP, I am doing open prostatectomy, nephrectomy. I give due credit to my yoga practice, the way of life. Regarding the food, one of the madam said just now, there are bad food also. सत्विक राजसिक तमसिक तमसिक खाना हमारा गीता में लिखता है you have there are bad foods you must not indulge. Vegetarian food, I should say, Bhagavan Krishna also said, and Bhagavan Krishna in the Gita chapter 6:16 it is said, na sasto yogasti na sakyanta manusya no swapna silchya na jagrato Arjuna. The one who eat alone, the one who doesn't eat, the one who sleep alone, the one who doesn't sleep at all, he cannot be yogi. So our scripture written 5,000 years ago, told by Arjun, no, told by Bhagavan Krishna to Arjun, still it is correct. No thing is removed or added. So our system, my Indian system, is very, very good. We are thinking that mixopathy, this and that. The initiation taken by Ravi Tuli and our friends, it's a really wonderful, I tell you. And this movement we have to carry forward, and we must tell the world that acupuncture, which I never learned, it works. As I have not learned, if I say acupuncture is non-medical, non-science, it is wrong. So there are a lot of things we have to assimilate from other systems. Thank you very much. Our members are really doing very well. Dr. Pandav, his way of dealing the Parkinsonism, Shindopa and all, instead of that, with that he's taking, even bee sting has been, that is really, I really appreciate Professor Agarwal. I don't know how old are you. I am 74, but still your mental faculty is still very high. I really enjoyed today's
मैं
seminar.
आपसे
Thank you
थोड़ा
very
सा
much.
बड़ा हूँ।
बोलिए आप, मैं सुन लिया नहीं सुन लिया।
मैं आपसे थोड़ा सा एज में बराबर का ही समझ लीजिए। मैंने मार्च में 74 पूरे किए हैं।
Okay, so you are slightly. I am now running 74, but still, Agarwal Saab, I am operating. I do this laparoscopic surgery, and my dexterity, that Shaibechya, the Arjun has the dexterity of both right and left. Shaibechya, the Bhagavan Krishna says, somehow I am able to do surgery, laparoscopy at this age also, because this is because of my lifestyle. Go to sleep by 9 a.m., get up by 4, Brahma Murta, Bharma Murta, and fasting, Ekadashi fasting. That particular Japanese who got Nobel Prize for fasting, our ancestors were doing in our country. Jal Niti, I am doing every day as a lifestyle. Jal Niti. इसी कारण से मेरा साइनसाइटिस सब घूम गया,
तो
हरे
सिंह साहब,
कृष्णा
अब
हरे
मेरे
कृष्णा।
ख्याल में आप परमिशन चाहते हैं तिवारी साहब?
Yes, sir.
अच्छा
Time is over.
सेमिनार आज
We have
का
to leave now.
वेबिनार.
Thank
Thanks
you,
to
sir.
all my experts, thanks to all the commentators like Dr. Singh and everybody. And I'm sure we will continue this concept in other webinars in
Yes.
extended forms.
Thank you, sir. Thank you very much. Thanks a lot for all of you to present here today, and we sure to be continue this webinar on the same topic. Okay, thank you. Thank you much.
God bless you.
Bless you.